Hello and welcome to another edition of the Adopt the Block News from the Block. My name is Mark Thompson, the director of the Adopt the Block Outreach Center. And today for News from the Block, I have a very special guest. Now, I have to say this is kind of personal. Have you ever got out of bed and felt kind of, you can't move? Now I understand why all those commercials for those slip-on shoes that you don't have to tie are on, because my body is stiff. So today for News for the Block, I have a special guest that's going to help us get through all these aches and pains. Welcome to the Pack 14 studios. We have Tanya Dickson from the Dickson Therapy. Welcome to Pack 14.
Thank you, Mark.
So let's start off. Like I said, I am so stiff. And we want to know about what you do and for your professional life, but why am I so stiff?
Well, unfortunately, the body ages. We like to blame it on aging, but we put a lot of load on the body every day. So when we're trying to do the daily activities, move, clean, cook, go to work, a lot of times that has a little bit of a consequence. So you may wake up in the morning with a little bit of stiffness, but there's a lot of things that contribute into that that can cause some stiffness to occur. And that's one thing that I would do is I would try to evaluate and look at what's the reason for your specific stiffness, because your stiffness might not be the same as mine, might not be the same as, the lady down the road. And there's a lot of factors that have to be considered. So if you want to know a little bit more about why you're stiff, you should come and see me.
Wow. And that's what we're here for today, News from the Block, Tanya Dickson. Now, let's introduce you to our audience. So tell us a little bit about yourself and your background.
Well, I've been practicing physical therapy for 12 years now. I started on the Eastern Shore, going to Warwick Community College, worked my way through Salisbury University, and then I went to physical therapy school at the University of Maryland Eastern Shore. I decided to become a physical therapist because I wanted to help people. And, when I was younger, I was always interested in things like psychology and counseling, but I love being physically active. I love being able to move. So I thought, what is a way that I can help people be physically healthy? So that kind of led me down the road into being, a physical therapist, as well as when I was younger, I was diagnosed with a connective tissue disorder. It's called Ehlers-Danlos, and I had to have physical therapy when I was about 19 years old. I was in the military at the time, and I was having some issues with joint pains and muscle pains, and I knew nothing about the profession. So I went to physical therapy in Salisbury, and I decided that that's the route I wanted to go. It helped me be successful and achieve my physical health goals. And that's how I decided in that moment, like, this is what I need to do, and this is what I meant to do.
Okay. So a person doesn't just walk up and say, I'm going to be a physical therapist. There's actually education that you have to go through. Let's just stop for a minute. What would you tell our young people who are going to college or looking for a career? What would they have to take in school?
Well, you'd have to get your bachelor's degree first. You can get your bachelor's degree in pretty much anything and then decide to go to physical therapy school for graduate school. But the ideal route to go for a bachelor's is doing something in biology, athletic training, exercise science, something that has to do with health and wellness. But by all means, you don't have to go that route. You start with getting a bachelor's degree, and then you apply to a physical therapy school. And the graduate school takes at least usually 3 more years, so you're looking at a total of about 7 years of education, depending upon what program you go to. If you were to do UMES locally, then that's how that would look. It'd be a 7-year degree. And then I've always really invested myself into continuing education, constantly trying to learn and expand on my knowledge. So even though I've been a licensed and practicing physical therapist for 12 years, I've taken continuing education courses for the entirety of that career.
So it's not just something that you just get up and say, I'm going to start tugging on people and you really have to go through training.
Yes.
Well, let me ask you something, because I see this term physical therapy and occupational therapy. Is there a difference or?
Oh, there is. So an occupational therapist is a type of therapist that helps somebody also be physically active, but they're looking at what they need to do on their daily activity or daily lives. So they're called independent ADLs, activities of daily living. And they will look at things like dressing, bathing, job-related tasks, fine motor movement with their hands. A lot of times you'll find occupational therapists working predominantly with their hands, hand pathology or hand limitations, but there are also physical therapists that are certified hand therapists as well. So there is a little bit of an overlap between the two professions, but as a physical therapist, we're looking at, individuals as a whole person, not just somebody who has arthritis of their knee or a spinal injury. It's a human being, and when it comes to being a human being, you have to consider a lot of variables. Things like what kind of nutrition do they have, what kind of past medical history or medications, what are their personal goals, what are their other pathologies they're dealing with, like high blood pressure, high cholesterol, diabetes, things like that, and how are our interventions going to impact them to achieve their physical goals and physical health, knowing the whole picture of the person.
Okay. So, if I come into your office, and we'll talk about that a little bit later, but when you come into your office, what would I expect when I first come in the first time?
Well, hopefully when you first walk into my office, you feel immediately comfortable. I try to set my office up to be a little bit more home comfort, not medical. In my office, I'm going to spend a good hour with you. You should expect to be very one-on-one with me personally. You're not going to see a lot of commotion and hubbub in the background. It's private and it's intimate. That way we can set a comfortable environment that you feel comfortable to communicate your physical health and history in its entirety. You should expect to be asked questions, detailed questions about why you're in my office. Is it because of pain? Is it because of some goal that you want to reach? A functional limitation? Do you want to go run a marathon? Do you want to get back to the gym? Or are you having difficulty going up and down stairs in the morning? Whatever it is, I'm going to ask a bunch of questions about that. What's the behavior? How does it act? What bothers it? What makes it better? And then that way, once we get through all of our questions, then you can expect to engage in a collaboration with me to come up with what the best plan of action or course of action is to allow you to achieve those goals. That way I'm making sure that I'm addressing your needs and your wants and your ability to do that.
Wow. So there's a lot to it. I just thought you just came in and you stretched me a little bit. So again, you come in, you go over the whole program with the person. So what type of equipment would you see in your office?
Well, what I currently have are some equipments for exercise and strengthening. It depends because everybody's level of physical activity is different. And there's not one set type of equipment that you need. A table, predominantly, and then really my hands and myself are all I need for the most part because I'm a very heavy manual therapist. I like to do a lot of hands-on work, and it's the type of treatment that I provide is kind of like a primary care physical therapist. So I am looking a lot at your health history and your physical well-being. However, sometimes we need to do a little bit more physical activity to achieve the goals that we're trying to accomplish, like reducing pain or improving function. So I have some weights. I have a functional trainer, a weight rack. I do have a treadmill that does have a very high incline and a decline on it because I want to be able to adapt to all different environments and terrains based on what the person needs to accomplish. I have a bike, and then I have some, manual therapy tools that I'll use for various reasons.
Okay. And like I said, it's very personal to me. I have my mom, my aging elderly mom. Sorry, Mom. But, I won't give her age, but she doesn't move around that much. And she always talks about she's stiff. And I know you can't diagnose her without seeing her, but when people say they're stiff, what are they saying?
Just saying that they're having a barrier to moving or to doing something that they want to do. The stiffness can be caused by so many reasons. When you hear about an aging population and you hear about stiffness, a lot of times many of us go to arthritis. We think about arthritis forming in our mind because that's something that happens with load and time and aging. And arthritis is a condition that affects a lot of people, and it can start affecting people as early as 20. I've actually had arthritis, diagnosed in my spine at 20. That's a normal thing to happen. It doesn't mean that it's pathological, and it doesn't mean that it interferes with someone's functional mobility. So for somebody like your mom or the aging population that's stiff, finding a way for them to move in a way that doesn't cause, more harm or hurt or fear for that person is what's going to be the most advantageous for them to be able to reduce the stiffness and improve their mobility. And it takes that intimate one-on-one time with the patient to help figure that out, because you can't just go tell somebody, oh, go to the gym, go for a walk, go do this, because that's not appropriate. It's intimidating, and some people don't really know what to do with that. So having some time to have somebody sit there with them and figure out what hurts, what doesn't, and how can I do it in a way that it doesn't hurt and it helps treat me is really advantageous for them.
You mentioned something about the gym, and here I go again talking personal. I haven't been to the gym in years. What would you say to someone like me that's never really been to the gym and all of a sudden I want to go and I hit those weights? What should we do first?
Well, I would say don't do it that way.
Okay.
Yeah. So a lot of people want to do that. They decide to make a healthy change in their life and they want to go at it hard or go at it big. And that's not the best way to do it. It's the same concept of fad dieting. If you want to lose weight and you're like, I'm going to go on this extreme diet and I'm going to cut out carbs completely or I'm going to reduce my intake, that doesn't last. So if you were to go to the gym and go big and go hard, it's not likely going to last. And you may also pay for that, essentially, because your body doesn't have the time to increase its capacity. So if you haven't gone to the gym in a long period of time, the load that you've put on your body has reduced, therefore it reduces its capacity. Now you want to go to the gym and make a healthy choice to improve. You have to increase load in a gradual way so that your body has time to adapt and build its capacity. So if you're confident and comfortable to go to the gym and do some exercise, I would say dose it small and then make it gradual. Gradually increase the number of times you go or how long you spend or what kind of activities or weights you use. And if you don't know what you're doing, you can always talk to the gym themselves and see if they can do a consultation, a free personal training session, or you can always come and see somebody like myself as your local physical therapist to discuss what your actual goals are. What do you want to strengthen, what do you want to accomplish, and what's the safest way to do that?
Well, I was going to ask you that. So coming to you first before we exercise, like I said, jump right into it. You would sit down with us, and what would the plan be for me to come in and talk to you?
Well, the plan that we would make, or the plan to actually schedule coming in and talking?
Well, me coming in to say I want to go to the gym, what would you say to me?
Well, I would start to say, what's your goals for that? What do you want to accomplish? Are you trying to increase your strength? Are you trying to just be physically active? Do you notice that you need to improve your cardiovascular endurance? What's your previous experience with the gym? What have you done before? What do you enjoy doing? Because that's one of the biggest things I use with my patients when I'm trying to advocate for them to be physically active and healthy. And everybody needs to exercise. We as a society need to exercise more. There's just people who just don't like to exercise, or they don't like the gym, or they don't like that environment. So what's the most important is if I'm going to advocate for somebody to be physically active, I need to find out what they enjoy. Because if they don't enjoy it, they're not going to keep doing it. So no matter what the reason is that you're in my office, whether it's for pain, whether it's for physical activity, you have a goal you want to reach, I'm still asking you a ton of questions because I need to know you. I need to know what's going to be the best thing for you, what you want to do, what your goals are, and then what you're bringing to the table as your baseline with your body, your mind, your health, and your nutrition.
What do you see as the most common issues when people come see you that people are having?
Spine pain, back pain. Back pain is one of the biggest epidemics of the country, and that's probably one of the biggest referrals or reason for people to seek for physical therapy.
Why do you think that is?
Well, pain is a complex bag, and it's not cut and dry. Everybody's pain experience is different. For example, you'll find people comparing knee replacements. Well, my knee replacement went like this, or my knee replacement went like that. No two knee replacement experiences are the same, and no two back pain situations are the same. So one reason that I think back pain is a big epidemic in this country is due to the overall physical inactivity. As a country and as a society, we sit a lot. We don't have a lot of time. We work a lot, and then we don't give a lot of time for us to, invest in ourselves. So, trying to promote healthy lifestyle habits is usually one of the points that I discuss day one. And I ask every patient, 4 specific questions, regardless of the reason that they're there, regardless of their pain or how severe it is. 4 questions are asked every time. And that is, what is your relationship with sleep? What is your relationship with exercise? Do you feel that your diet is healthy? And what is your relationship with stress? Because if I'm going to address the person's pain, functional impairment, or goals, I need to know what's going on with those 4 things in their life. And usually when I have patients who suffer from back pain, at least 1, if not sometimes all 4, have an area that it could improve.
Wow, I never thought about that. So even with sleep, do you talk about how people should number of pillows they should sleep on? And
sleep is one of my favorite topics, but I don't recommend pillows. I don't recommend mattresses because there is no cut and dry answer for that. But what I will talk about is what does their sleep behavior look like? Where do they feel there is an impairment? What do we need to do to make it better? And how important is that to them? Sleep is usually very important to everybody, but sleep is a very, very mixed bag when it comes to reasons for why people don't sleep. And then sometimes it's mental, sometimes it's comfort, sometimes it's pain, and sometimes it's stress. And there's other, and then it gets into some medical diagnosis too. There's some other reasons. Mm-hmm. But really where I go first is figuring out where they feel the biggest impairment is, so that I know where to go. If it's comfort and pain because of the pillow or the mattress, then I'm looking at them, not their pillow or mattress, to see what is contributing to that. Sometimes we go into sleep positions, sometimes we go into things like that, but that's not the answer. There's no perfect answer to say, this is the mattress for you, or this is the pillow for you. It's more of what's going on with you that means that you can't sleep on that mattress.
Wow, I never considered that one. Mm-hmm. What about medicine? All these pills that are on the market. What's your opinion about taking these pain pills?
Well, I'm trying to get everybody as much away from that as I can. So I strive to practice to treat people's pain, impairments, and functional limitations without medicine, injection, and surgery. One of my favorite topics to get for a patient is to have somebody who is on the schedule for surgery and see if I can't get them into my office first and get them to cancel that surgery.
Wow.
So medication, injections, and surgery are things that I'm trying my hardest to get people away from because nobody wants them. They just want to feel better. And then, people are willing to do what they need to do that. But people don't like putting foreign substances in their body. They don't want to have shots. They don't want to go on the operating table. Things like that are scary. So if there's other ways to accomplish what they need to improve their function and their quality of life without it, I love to have them, in my office, willing to give it a try.
So come to you before you seek the surgery and things like that. What about the ones that have already gotten the surgery on the backs and the knees? Do they still come to you for physical therapy? Absolutely.
Because they did their surgery on their back or their knee, as you said, and now they need to get back to their goals of what they were trying to accomplish. So then they need to come back. Occasionally, there's times where people might have a surgery and that was it. That's all they needed, and they've met their goals. That does happen sometimes. It depends on the situation. But there's many times that, after you're recovering from a surgery, you still have to do something to heal and rehab and get back to your goals. So, yeah, I'll see them after as well.
Okay. And now, we always bring this up with the cost of medicine and going to the doctors. Come and see someone like you. What do they need to have? Medicaid, Medicare, insurance, Blue Cross? I mean, what's the steps for coming to see you with insurance or payments?
So Maryland is a direct access state, and what that means is that you can seek physical therapy services, evaluation, or treatment without a referral from a physician. Anybody can go and do that. Now, I designed my company as an out-of-network provider, and what that means is that I don't participate with insurances. So we are a predominantly cash-based company, and the reason for that is because I want to work for the patient. I want to service the patient. I don't want to work for the insurance company. I don't want the insurance company to dictate what I can and cannot do for my patient or tell the patient whether or not they're allowed to have access. Because if you have Medicaid or if you have Medicare, then because of the insurance, you do need the referral for Medicaid, or you need a doctor to sign off on your plan of care because your insurance is paying for it. If you have Blue Cross Blue Shield, you don't need the referral, but then Blue Cross Blue Shield or whatever, I don't want to throw too many names of insurance companies because every policy is different, but some might say, well, you want to do dry needling. Well, we don't cover that service. So you have to pay out of pocket for that, in addition to you paying your premiums, in addition to you paying your copay. And you need to be seen 3 times a week for 6 weeks, which is an astronomical amount of visits and a big sacrifice on your personal time. Because as we said, we're all busy. We work and we have families. We don't have time to go see a therapist 3 times a week for 6 weeks. That's 3 hours a week. That's a big sacrifice. So I designed my company to be an out-of-network provider for these reasons. That way I can spend a full hour of my one-on-one time with them, not overbooking, not bringing multiple patients in at the same time and spending 10 minutes with one, 15 minutes with another. You get undivided attention with me. Because we spend that full hour, we're able to really dive deep into what your goals are and what your impairment or limitations or whatever it is that you're there for, and set goals that we're going to work on together. Because we did that, now I only really need to see you maybe once a week. So now that you've freed up 2 hours of your life, and you've been paying 3 co-pays a week to come see, so instead of paying 3 co-pays, you pay 1 visit for cash. And then, if you have out-of-network benefits, then you can always submit your receipt that you get from me to your insurance for reimbursement. Okay. That's based on your policy, though.
Okay, well, that's good to know for people. So again, you've been in this business for how long as a physical therapist?
Over 12 years.
12 years, so you're not new to it. Someone to see you, how would they go about? They just go. How would they reach you? And where's your office?
So my office is located on Tilghman Road. It's over where the MVA is on the other side. If anybody is familiar where the old Kmart was, but it's the Oak Ridge Baptist Complex. I'm right in there next to Olympia Fitness, Life Touch Photo, and then there's Downtown Bridal and the new Junior Achievement, where that's being located.
So you're right there. So is it open now? It's open now. So I think there's something special coming up soon. Why don't you tell us about that?
So I am having a grand opening event. It's scheduled for August 21st. It's a Monday evening at 5:30. What's special about the grand opening event is that it's a charitable event. I'm the treasurer on the board of directors for DILA, the Deaf Independent Living Association. And this non-for-profit organization means a lot to me and my family, predominantly because my husband is deaf. He does wear hearing aids, and his hearing aids help him hear some, but it's very limited. Communication has always been, a struggle for him and for the rest of my family. So, we decided that we wanted to learn sign language to start being able to communicate better. We learned sign language through an interpreter at DILA who became a very dear friend. So then I got to learn more about the organization and see that these people had a lot of need. It's another non-for-profit organization where there's individuals who are rather low income, or they could be in need of medical, physical services, clothes, food, anything. And funds are limited, as most non-for-profits can attest to. So I started to get very active with that organization and trying to just raise funds, get donations, things like that. Eventually, because of my role as a physical therapist and being able to help with physical needs, ADA accommodations and assessment, they invited me to join their board of directors. And then because of some business background, they invited me to become their treasurer. So my role with them grew over the year. And now that I have this opportunity to celebrate something very dear and personal to me and make it advantageous to them to raise funds. So it's a grand opening event for my business, but the premise of it is to have donations and giveaways from local businesses and from myself for raffling to raise funds for DILA. So I'm really excited about that. My donation is a 55-inch TV, so hopefully people come and buy some raffle tickets. They're only $5 a ticket and enter to win a TV. But I have other local businesses already donating. So I know one for sure is Brick Room. They've given me some gift cards for people, and there's a few more coming. But until I have the actual final answer from them, I'll wait to share them.
Wow, this is exciting. Yeah. Again, this is Mark Thompson. I'm the director of the Adopt the Block Outreach Center, and we're here in the PAC 14 studios with Tanya Dickson of Dickson Physical Therapy, and we're going to have all this information at the bottom of the screen for you at the end of this show on how you can make arrangements and contact her. Before we go, is there anything else you'd like to say to the people in the community about physical therapy? Sometimes it probably gets a bad rap, but what would you say to someone that's going through problems with their knees or backs? What would you say to them right now?
Well, if anybody has ever had a negative experience with physical therapy, I would tell them to try to keep as open of a mind as you can, because no two experiences are the same. They can apply the same concept as if they go to 2 different doctors, 2 different restaurants. It's not always going to be the same. And my company, I strive it to be very different. So what I would love to say to the community is have one physical therapist. We have one doctor, we have one dentist, sometimes we have one chiropractor. Why not have a physical therapist? And that person be your person. So if your experience with physical therapy is to go into a clinic and see a different person every time and basically have the feeling like you're a number, then seek somewhere else. seek somewhere where it can be that you are one-on-one with that person. They know you, they know your goals, and they're attentive to you. If you feel comfortable with them and you're confident that you're reaching your goals, then you're in the right place, no matter who that person is.
Okay.
So that is possible in the profession. And if they have that, then a lot of times that will greatly reduce healthcare costs, time out of work or disability, doctor's visits, and time. So.
Okay. Now, I guess you're located next to the weight place,
Olympia Fitness.
Olympia Fitness.
Yes.
I get hives thinking about exercise. If someone again goes to the gym and wants to come out to see you, is that an issue? Will you take them right away, or do they have to?
If I can accommodate, I try to stay very flexible. Granted, if I have another patient scheduled at that time, they would have to wait around that, because I will never interfere with another person's time with me. But I'm very adaptable. And I've had patients who have had emergency needs, like if they're, working as a first responder or something in that line of field, and they have something happen that they feel is going to impair with their ability to do their work. I've even gone in on the weekends and seen them. I'm very accessible. People they'll have my cell phone number, email, social media. They can reach out to me whenever they need. I try to be very responsive and fit them in when I can.
Okay. And again, we're here with Tanya Dickson from Dickson Physical Therapy.
Mm-hmm.
We'll have the contact information. And one more time, when is your grand opening?
August 21st, which is a Monday evening at 5:30.
Okay. And again, I know it's special to you with the nonprofit that you're working with. What's the name again?
The Deaf Independent Living Association. They go by DILA.
DILA. Okay. And again, so if someone was hearing impaired coming into your office, would they still feel comfortable?
I would like to believe that they would feel very comfortable.
Do you know sign language?
I do.
You do?
Yeah.
How would you say goodbye? I'll put you on the spot.
Would you say goodbye?
Oh,
That's great.
Of course.
I could say good morning.
Good morning.
Yeah.
And what else? I'm pretty interested in that. What else do you know?
I would just say, hey, how are you? Or I would say, how are you feeling today? Do you have pain? Where is your pain? How much pain do you have? Is it 1 to 10? So there's a lot that I can do. However, I am not a certified interpreter, so I can do basic communication. I communicate with my husband effectively. I can communicate with the deaf community to a degree. If somebody was deaf and in my office, I would be providing a certified interpreter for that person, just because I can't assume that I understand them 100% or they understand me, and they have a right to full communication.
All right.
So,
well, there you go. Tanya Dickson from Dickson Physical Therapy. Thank you for joining us today. And again, thank you for joining us from News from the Block. My name is again Mark Thompson. I'm the director of the Adopt the Block Outreach Center, which is almost complete. We just want to give a shout out to the Maryland Food Bank at this time for providing the food that we do every first and third Saturday of the month. And again, if people need food in the community, we're still located at the Emmanuel Wesleyan Church, 217 Beeland Park Drive. On the first and third Saturday of the month, come by at 8:30. You don't need to show anything. We just ask for your name, and then you just come in and get food for your family. But we're open every first and third Saturday from 8:30 to 11. And we're just looking forward to our 818 Benny Street location, which should be ready. Drive past there and take a look. It should be ready by September. But once again, this is News from the Block. Mark Thompson saying we love you, and we'll see you next time.